Bismillah Rahman Rahim. First of all, I'm very grateful to all of you, and let me introduce myself. I'm Professor Dr. Iqbal Afridi, who I'm the Distinguished National Professor and Meritorious Professor of Psychiatry at Janab Sindh Medical University. It is a great, gives me a great pleasure to meet all these stalwarts of the health, like Professor Gideon Lang, CBE, she's the president of the Royal Society of Medicine, and Chancellor Professor Raymond Keane, OBE, who is the Tony Buzon Academy Chancellor, and Professor Michael Crawford, who is the authority on the subject of nutrition and preventive psychiatry, and also the distinguished son of psychiatry, Professor Ahmed Ali Khan. I think we should have a blessing for him, because at this age he is instrumental to have this gathering, and also he tries to have a linkage between Pakistan and the rest of the world, because the lesson was learned from the COVID-19 that we should think globally. From Wuhan, one thing comes and spreads all over the world, so we have to think globally and act locally. And I'm also thankful to Mrs. Mahar Khan. She's very instrumental, and she has a big school in Pakistan, charity school. And Dr. Gul, who was the president of the European Sindhi Association, Dr. Almas, who is also the innovative surgeon, and he always provides service in Pakistan. So this is a great opportunity to meet the stalwart of the health in this. I forgot your name. I don't know. I'm Aziz. Okay. So the Royal Society of Medicine is a great academic organization that works to improve the health and well-being globally. In this regard, we have to focus on the following collaboration among us. One is the capacity building, because in Pakistan, which is a population of 325 million population, we have hardly 600 psychiatrists, and there are only few child psychiatrists, and most of our population is a young nation. So we want some collaboration in the child psychiatry, forensic. There's no forensic psychiatrist in Pakistan, and addictionology, and so on. And we can have a lot of good collaboration in terms of research, because we have a lot of patients. I see 100 cases of psychiatry per day. Until now, I've seen 1.5 million patients. So that means we can have a research collaboration. We have a lot of ground to have data and interchange to that, and we can work on positive well-being, and so that, like the recent unrest in UK shows us a lesson that we have to promote positive mental health. The people should compete among tolerance, among sabr, which is and resilience, and in good way they should compete rather than competing in the bad way. So in this way we can have improve the quality of health services not only in Pakistan but also in the British. So in this regard, I'll request the President that we should have some access to this Royal Society and subsidized rate for the membership or the fellowship is very expensive in Pakistan, so people are not opting for this. So or the other way, we can have webinars that can be useful source of spreading things, and we can have, if we can have access to the library, because nowadays I'm working on the research area, and many of the institutions are lacking to have access to the journals and worldwide. So if we, as a president, you can have some access provided to this poor people where we don't charge any money from patients. So the other thing would be network opportunity, and we can have community services. In this way, we can collaborate in terms of research, academics, and so on, promoting positive mental health. And in this regard, if Michael Crawford has started the preventive psychiatry, and we are having a nutritional psychiatry. So in that way, we can not only prevent diseases but defeat at all level by all means. Thank you very much for your attention.
So may I